Hi, my name is Ashley Velasquez. I'm going to be performing the physical assessment assignment. Today is Monday, February 2nd. Okay, so I'm going to go ahead and get started from outside of my patient's room. Okay, I'm going to check the door for any precautions. I'm not seeing any, so I'm just going to go ahead and perform standard precautions. I'm going to knock on my patient's door. Hi, is it okay if I come in?
Yep.
Okay, hi, my name is Ashley. I'm going to be your nurse for today. Okay, I'm going to go ahead and come over here and wash my hands. All right. Okay. Do you have any allergies I should be aware of?
No.
Okay, do you mind if I see your wristband? Can you verify your name and date of birth for me?
Jason Cinda, January 30th, 2001.
Okay, perfect. And then that number does match my medical record number. So I'm going to go ahead and put on some gloves. I'm checking the bed frame just to make sure the bed's locked, the room is safe and clear, and both side rails are up. Okay, Jason, I'm just going to go ahead and come back here. Is it okay if I touch on your hair?
Yep.
Okay, so I put on my gloves, and then I'm going to go ahead and assess the scalp. I'm seeing normal hair distribution, no signs of lumps, bumps, or lesions. Okay, and then do you feel any pain or pressure anywhere that I'm touching on your scalp?
Nope.
Okay, great. All right, and then I'm just going to come over here and assess the face. Okay, I'm not seeing any signs of lumps, bumps, or lesions here as well. Okay, Jason, have you ever had any kind of nasal surgery, any procedures, any polyp removals?
Nope.
Okay, great. So I'm going to have you go ahead and tilt your head up for me. Okay, I'm going to take a look inside the nares. I'm not seeing any excess drainage, no blood, no signs of polyps. Everything looks clear. Okay, so go ahead and close one side of your nostril for me. Okay, take a deep breath. Okay, perfect. And do the other side. Okay, and then I'm going to have you close your eyes, okay? All right, can you go ahead and take a smell and let me know if you can smell that?
Apples.
Okay, awesome. So you can go ahead and open your eyes back up. Cranial 1, nerve alt 1 olfactory is intact. Okay, so I'm going to have you come ahead, look straight. I'm just going to briefly shine a light in both eyes and then down the middle, okay?
Okay.
And then before I do that, I'm seeing that the pupil size is about a 6. Okay. All right. All right. Okay, so the pupils do constrict bilaterally. All right, and then I'm going to have you follow my pen light with your eyes, okay? Okay, and they also converge bilaterally. And then, okay, can you go ahead and read this for me?
Associate degree nursing.
Okay, awesome. And then can you go ahead and read that sign for me over there?
Stop.
Okay, awesome. All right, so cranial nerve number 2, optic is intact. And then before I move on, could you go ahead and pull down on your under eyes for me? Okay, sclera is white and conjunctiva is pink and moist. Okay, and then now I'm going to go ahead and have you follow my pen light, okay? Keep your head straight and just follow with your eyes, okay? All right. Okay, I'm going to come across here, and down. Okay, so cranial nerve number 4, 5, and 6, trigeminal, abducens, and oculomotor are intact. Okay, so I'm just going to come over here. Is it okay if I touch your face?
Yep.
Okay, so you just let me know if you're having any pain or pressure. No?
Nope.
Okay, everything looks even and clear. All right, so go ahead and puff your cheeks out for me. Raise your eyebrows, and then give me a smile. Okay, perfect. So cranial nerve number 7, facial is intact. Okay, now I'm just going to take a look inside your ears, okay?
Okay.
All right. Okay, and then I'm going to just have you look this way. I'm going to take a look inside this one. Okay. All right. The earlobe seem clear. No excess drainage or bleeding. Okay, so do you wear any hearing aids or have any implants?
No.
Okay, so I'm going to come behind you. I'm going to whisper a word. I'm going to have you close one side of your ears and then the other. And you're just going to whisper that. You're going to tell me that word back, okay?
Okay.
All right, so I'm come back here. Okay, blueberry.
Blueberry.
Okay, cover the other side for me. Strawberry.
Strawberry.
Okay, awesome. So cranial nerve number 8 is intact. All right, now I'm going to go ahead and take a look inside your mouth, okay? All right, open wide. Okay. All right. I'm not seeing any signs of cavities, no signs of lesions or bleeding or swollen gums. Okay, so go ahead and stick your tongue out for me. Swallow. Okay, and I say hi.
Hi.
Swallow. Okay, and then go ahead and stick your tongue out for me one more time. Lift it up, down, and then side to side. Okay, so cranial nerves number 9, 10, and 12, glossopharyngeal, vagus, and hypoglossal are intact. Okay, all right, so now I'm going to come back here. I'm going to take a look at your shoulders, okay?
Okay.
All right. So assessing my patient, shoulders do look even. I'm not seeing any excess hair growth, any abnormalities. Okay, do you have any pain or tenderness when I touch on your shoulders?
No.
Okay, go ahead and shrug up for me. Okay. All right, so the shoulders are intact. Okay, I'm going to come over here and I'm going to take a look at your neck. Okay, again, I'm not seeing any abnormalities. The trachea is midline. Okay, so I would then palpitate the carotid pulses. Okay, one at a time. Okay, so you come over here. All right, awesome. And then if my patient was in a bed, would lay them flat and then check the neck sides for any jugular vein distension. I'd have them sit up 40 degrees, check again. Okay, but everything's looking good. All right, so now I'm gonna go ahead and take a listen just on your throat, okay? When I tell you to, just hold your breath for me, okay?
Okay.
All right. Okay, hold your breath for me. Okay, and then again. Okay, so not hearing any signs of a bruit. Okay, and then I'm gonna go ahead and listen to your lung sounds, all right?
Okay.
Okay. Here, okay. And first, go ahead and take a deep breath for me. Okay, and another deep breath. Okay, deep breath. Deep breath. Another one. Deep breath. Deep breath. Deep breath. Okay, perfect. Lungs are clear bilaterally anteriorly, so I'm going to come and check them on your back. Okay, if you could sit up a little bit for me. All right, we're going to do the same thing. Go ahead and take a deep breath for me. Okay, deep breath. Another one. Okay, deep breath. Deep breath. Last one. Okay. All right, so lungs are clear bilaterally, posterior as well. And then I'm just gonna go ahead, I'm gonna have you sit forward a little bit. All right, I'm gonna check that the lungs expand bilaterally. Go ahead and take a deep breath for me. Okay, and the lungs do expand bilaterally. I'm just gonna come over here and you can lift your arm up for me. Okay, and the AP diameter is normal. You can go ahead and put your arm back down. All right, I'm just gonna go ahead and listen one more time and listen to your heart sounds, okay?
Okay.
All right. Okay. So I'm gonna put it over here. Okay. Here. Okay. And then we would listen to the apical pulse for 1 full minute. That's the true pulse. Okay, so the heart is clear. Now, if my patient was in a bed, I would go ahead and have them lay flat at this point. I'm going to assess the abdomen, not seeing any obvious signs of distension, no abnormalities in skin color or temperature. Okay, and then are you having regular bowel movements?
Yep.
Okay, any appetite or nausea issues?
No.
Okay, all right, so I'm going to go ahead and take a listen to your bowel sounds, okay?
Okay.
All right, make sure this is warmed up. So we start in the lower left quadrant. Okay, the upper left, upper right. Okay, and the abdomen sounds are clear. Okay, and if we didn't hear any vowel sounds, we would listen for the full 5 minutes. Okay, so now I'm just going to go ahead and palpate your abdomen. Let me know if you have any pain or tenderness.
Nope.
Okay. Right, so the abdomen is clear. All right, so now I'm gonna go ahead and take a look at your upper extremities. Take a look at the arms. Hair distribution is normal. I'm not seeing any signs of bumps or lesions. Temperature is normal. Okay, skin texture is also normal. And so is capillary refill. Okay, so I'm gonna have you hold your arms straight out for me. Okay, now go ahead and flip them over. Bring them up, bring them back down. Let's open them wide, and then bring them back in. Okay, go ahead and give me a little push. Give me another little push. Okay, perfect. And then I'm gonna have you push up on me. All right, push that. All right, and then give me a little squeeze. Okay, so the extremities are normal. Strength is good. Now I'm gonna have you close your eyes. Okay, and I'm just gonna give you a little tap on these upper extremities, and you let me know where I'm touching. Okay.
Left table.
Okay.
Oh, right arm.
Mhm.
Left forearm.
Mhm.
Right forearm.
Mhm.
Right hand.
Mhm.
Left hand.
Okay, great. So the upper extremities are normal. Up here, I can check the brachial and radial pulses. Okay, so then I'm going to do the same on the lower extremities. I'm just going to go ahead and assess them. I'm not seeing any abnormalities. Skin color is still normal. Temperature is normal. Skin texture is good. Over here, we can check the popliteal pulse, the posterior tibialis in the foot, and then the femoral pulse right in the groin area. Okay, so I'm just going to have you do the same thing. Put your legs straight for me. Okay, go ahead and push up on me. Okay, push down. Okay, and then out. Okay, and in. All right, and then flex your toes forward for me. And then flex them back against me. Okay, strength is good and normal. And then I'm just going to have you close your eyes again. I'm going to give you a little tap. You let me know where I'm touching, okay?
Okay.
All right.
Right thigh.
Okay.
Left thigh. Left shin. Right shin. Left leg. Left foot. Right foot.
Okay, awesome. And then this would also be the point in time where I could have my patient lay on his side in the bed. I would assess the spinal column, make sure it is straight and intact, also assessing the back and seeing that it's normal. So we're also saying the cranial number 11 accessory is intact. We could also check the anal area at this point in time and the buttocks. I can question my patient about if he's having regular testicular screenings. If it was a woman, we could talk about vaginal care and mammograms. Okay, so I'm gonna have my patient sit back up. Okay, everything looks normal. So now I'm gonna lower the bed back down to a good height. I'm going to make sure the side rails are still up. Okay, I'm going to place your collar right here. Okay, Mr. Sinda? All right, and then you have your water here, making sure the room is still clear before I head out. I'm going to dispose of my gloves, and you just go ahead and press that collar if you need anything, okay?
Okay.
All right.